Hi, my name is Diane Elms, and I am the CEO and founder of the Phoenix Rising Center. In 2003, we received our charitable status as a nonprofit organization. And the Phoenix Rising Center has been running very quietly since that time. But in last July 2016, the board made a decision to as of September 1st, 2016, to go full-time with the Phoenix Rising Center. So from that point on, that is what we've done. So I would like to read our vision statement. You can listen to the mission statement in the video that says what is the Phoenix Rising Center, but this is the vision statement: to build, equip, and maintain the Phoenix Rising Center so it can provide hope and the best care possible for all those that choose a drugless approach for their total health and wellness. And that is what the Phoenix Rising Center is all about. Is about looking at the body and coming up with a holistic approach that is individual for each person. Now, I want to just talk about some issues that happen when you're a non-profit organization. It means the bills still need to be paid. But what happens is when people come, if they can and if they choose to, they can give a donation for the time they spend at the Phoenix Rising Center. Now, if somebody actually has benefits, then they will be billed at $125 an hour. At this time, that's what the bill receipt will be at. So again, if they have benefits, they will be paying at $125 an hour. But if people do not have benefits or any means to be able to have complementary health care, specifically in drugless cancer care, they will be able to come to the Phoenix Rising Center, and if they can give a donation, they can give a donation to whatever they can. You see, I believe that we all should have that choice, no matter what our financial situation is, to be able to have proper health care and to have the choice, if they want to have complementary care. You see, back in 1995, I got sick and I was told that I would never walk again. And for 18 months, I went through multiple testing, and that was the answer. I would be in pain, probably be in a wheelchair, and I would never be able to walk again. Or I would get to the point where I couldn't walk again. My husband and I chose to do complementary care, but we had to pay for it all ourselves. We know what a drain and a strain it was on us financially at that time. Although my husband had benefits, they did not cover anything to do with complementary care. They only covered if we wanted to have a prescription. And that wasn't helping me. I did try, but it was not what was helping me. So when we chose that, we understand that it does make a financial strain on people. So we would like to, and that's why we took out our application to get our charitable status for the Phoenix Rising Center, so that people in the future would have an option to be able to come to a center that they could, no matter what their financial situation is. So far what has happened is those that can't afford come and give a donation if they can, and others, it just seems, it's just amazing how in a week, others that come just want to give more, and it all balances out. But it's time to move to a bigger facility. And that's why we need to really get the message out that the Phoenix Rising Center would like to incorporate more healthcare practitioners, thus needing a larger building. And we would also like to incorporate a lab to do blood work, because it's so critical with drugless cancer care patients to be able to be on top of what's going on. And there's also been a real challenge with people getting their CEA marker, which we believe at the Phoenix Rising Center is a valuable source for prevention for cancer. And with all the challenges in getting the cooperation in our healthcare system to get that marker done for patients, either as prevention or to monitor those that are choosing a drugless approach to cancer care to get that marker done, it is a critical thing of what we need, will need at our facility at the Phoenix Rising Center. So to give you an idea, if you make an income of $60,000 and if you give a donation of $3,000, you will actually get, and now this is just a rough estimate, of course everybody's individual financial situation will bring up different numbers, but just straight, if you make a $60,000 income, you give a $3,000 charitable donation to the Phoenix Rising Center you will receive approximately $1,164 back as in income tax. So you'll get that money back. Whereas if you went to a facility and you spent $3,000 on and you claimed it on medical expenses, you would only receive $249 back. There is a huge benefit to being able to make a donation and towards drugless cancer care. But I'm not just saying that for an individual person that comes. I'm reaching out to those corporations and companies and individuals that have maybe given money before to research or other facilities towards traditional cancer care, as in chemotherapy and radiation and along that line, and having them open their mind up to be able to give financially towards a center that is using a more complementary approach. I believe that it's time for changes in how we look at our healthcare system and changes as to you and I, how we look at healthcare in general. We need to be able to take a holistic approach, meaning the mind, body, and spirit, and bringing those all into balance before people will have total health and wellness. Will you support us? Will you join in on this? You can give the office a call at 905-768-0848, or you can go online, www.phoenixrisingcenter, spelled CENTER.ca or .com. You can sign up for our blog, you can give a donation, or you can send a check in to Phoenix Rising Center, 603 10th Concession, Hagersville, Ontario, NOA 1HO. You know what? You and I together can make a change in someone's life. We've estimated that it costs about $8,000 for someone to have a full year of drugless cancer care. Now that might not include all of their protocols, but that's a general average of what we've come up with. And so can you imagine how much $8,000 can change somebody's life? And I'm not saying it needs to come from one person, but if everybody does a little bit, do you know how many people will be changed because you and I have taken the time to care for someone else? You know what? If we all work together, many, many, many people can be healed through complementary care. Thank you.